And good morning. Good morning. You're tuning into.
Good morning.
Good morning. Okay, is everybody there?
Can you hear me?
I hear you, Dr. Browning.
Okay.
Do we have Diana Garcia Burns on as well?
No.
Okay.
You're stuck with me.
Oh, that's fine with me. This is the City of East Chicago show here on Wjob AM 1230 and of course 104.7 FM. I'm Verlie Suggs, the host of the show. And with me this morning is Dr. Gerri Browning. He is the Health Commissioner for the City of East Chicago. So how are you, Dr. Browning?
I'm good this morning, very good.
Great. Well, it's great to have you on, of course. So much is going on in the world and definitely right there in the city of East Chicago. So we're so blessed that East Chicago is still one of the two cities in the state of Indiana, or Lake County rather, that has their own health department. And so you're able to not only address, but respond to some of the things that are happening worldwide. So we appreciate you being here this morning.
Thank you.
Dr. Browning, of course, COVID-19 is the #1 issue affecting Americans today, affecting East Chicagoans. How are the numbers looking right now? We tend to focus on numbers, and we've seen some escalations around the state.
Well, I think all things said and done, East Chicago has relatively low numbers compared to many areas of the state. We're surrounded by hot spots, but I think currently, as of yesterday's count, we have approximately 679 positive cases in the city. It breaks down ethnically into approximately 186 African Americans, 420 Latinos, 33 white or Caucasian individuals, and about 40 individuals who did not identify by ethnicity when they tested.
Now, out of those 679 cases, how many fatalities have we had, Dr. Browning?
Well, I'm pleased to say that we've been hovering for the last couple of months without a fatality. We've only had 14 deaths in the city boundaries, 8 men and 6 women. I think that is in part due to the very dedicated and specific work that they've done at St. Catherine's Hospital. Early on in the COVID pandemic, they decided to have a dedicated COVID team and a specific area of the hospital dedicated just to those patients. And only a certain group of physicians, specialty physicians, as well as primary care physicians, are allowed to care for those people. So I think that patients who've been admitted to St. Catherine's have gotten very dedicated and specific treatment, and they've gotten state-of-the-art care, and that has kept the number of fatalities down to a minimum. And again, for the last 2 to 3 months, as far as East Chicago residents are concerned, there have been no deaths recorded.
That is amazing that when we look at what's happening around this country, and especially the state of Indiana, that East Chicago is standing out with, so few fatalities. Do you coordinate with St. Catherine's? How does that work with you as the health commissioner and the only hospital in the city of East Chicago?
Well, I have an open communication with the leadership at the hospital in terms of getting data and information. What we coordinate is some degree of testing that certain individuals might need. We've been able to coordinate that with the hospital's testing site. But they're an independent entity. They work as a part of the community healthcare system, and so they've been in our community forever. It seems I was born at St. Catherine's, as many of us East Chicago residents were, and they continue to provide care independently. I mean, the health department works with the hospital system on a number of things, but in particular with this pandemic, there is a priority testing for our first responders like police and fire department members who might be symptomatic or have been exposed. And that was established early on in this crisis. And so we
now, how do you work as far as with other local health departments, the city of East Chicago with Dr. Walker there, or with the Lake County Health Department with Dr. Vavilala?
Well, we're very unique in the state of Indiana that East Chicago and Gerri are the only two cities left with a health department. We're in the catchment area of the Lake County Health Department, but we function very independently, and we cover our catchment area, which is, in this case, the city of East Chicago. We cover it independently. The State Department of Health gives us all support in terms of supplies and data and information, and they're the ones that compile that actually do the testing that's been going on for the most part, and then they report that data back to us. As far as working with the city of Gerri, Dr. Roland Walker and I have been colleagues and friends for a number of years, and we've worked on other medical community organizations as well. And so we were able to coordinate early on about, in regards to testing, getting testing started in our cities, and there was so much that most of the world did not know when the pandemic hit. And so we had to quickly get up to snuff. And so, Dr. Walker was very helpful in terms of information. Gerri was out front with the state coming in with testing. And I worked with Dr. Christina Botts to get testing at Central High School in East Chicago. And we've been rolling ever since then. And now we're about to open a permanent testing site in the city. So that will be helpful as our residents continue to need to be tested. So obviously, if we've got less than 700 positive cases, many more people have actually been tested in the city. In addition to that, any person who's a resident of Indiana can be tested at our testing sites as they rotate around the catchment area of Northwest Indiana, or for that matter, anywhere in Indiana. If you're an Indiana resident, you can be tested at one of these state-sponsored sites. So,
Dr. Browning, when East Chicago gets their permanent site up for testing, will it be at the health department, or have you already had a location planned?
Well, in coordination with Dr. Deetta Wright, who's the superintendent of schools, she is going to allow the state to set up a permanent site in one of her facilities. All of the school facilities are not operational in terms of students on a daily basis, so we will have the opportunity to have a site in one of her facilities. At this point, it's looking like we may use the administrative building, which is the old Washington Elementary, located by the Block Baseball Stadium, the Washington Park area there. So, at this point, it looks like, we'll be locating there. Things move kind of slowly with the state. We've looked at a number of facilities, and again, at this point, it looks like that's where we'll be able to have access because of, easy access, parking, security, all the things you need to have people come in, be socially distanced while, there for testing, and then be able to, leave in an expeditious manner.
Dr. Browning, since you brought up the schools, that seems to be one of the number one topics. There are two things that are of controversy right now, and one being the opening and reopening of schools. Do you and Dieta Wright, the superintendent of East Chicago Schools, have discussions over the possible opening or e-learning, or what the verdict is going to be for East Chicago Schools?
Absolutely. We've been coordinating and working very closely with the superintendent. I am aware that they're looking at a July 31st date to make a hard decision regarding whether schools will open or whether they will go with their current plan, which is a hybrid of both some students at home and some doing e-learning, and then some students in schools, so that they'd be able to be properly spaced and surveilled throughout the day. So I think that's very important. I know that the controversy is that, one, children are not easily corralled and kept in one place, and they're very hands-on and touchy, and there's all sorts of issues in terms of their daily maintenance while in a school setting, as well as parents and families are concerned that they would go to school and be exposed to others who might then expose them to coronavirus. As well, the teachers are the older individuals and more susceptible, many because they have pre-existing medical conditions, and so they are of great concern. And as we know, children can become ill with this virus, but it does seem that they also can be carriers, and so everybody is at risk. I think what we have going for us in East Chicago is that early on, we got the message out about distancing and hand hygiene and personal environment hygiene and sanitization and wearing masks. And I think the numbers kind of speak to people adhering to that. There's no way of totally telling how adherent they are, but it does seem that in the midst of everything going on around us, East Chicago is holding reasonably steady. And so
well, I have to definitely contribute that rather to Mayor Copeland, as well as yourself, Dr. Browning, and of course, Diana Garcia Burns, the director of the health department, for not only being proactive, but staying right on it.
Absolutely.
Let me ask you this, because I know this seems to be one of the most controversial issues, and whoever would have thought it would be, is the wearing of mask. How is that handled in the city of East Chicago?
Well, we are trying to promote and follow the guideline that says that areas that wear masks tend to have fewer positive cases. And there's actually been some retrospective studies that have looked at all the states, and the states that have actual mandates are showing better numbers. And so the city has been upfront. Mayor Copeland can tell you how insistent I was that he and everybody around, I was vehement about, just wear the mask. I don't want to debate about it. Put the mask on, have all the city employees put the mask on, and then we got the word out to the people. And so
he actually followed your directive here on WJOB, where he and Chief Cerner both had their mask on.
Because he knew I'd probably be looking, but I was extremely vocal with him about that. And it was no debating that issue. We were going to have masks, and I believe that it is working. We have policies that if you're in city buildings, whether you're a citizen going for services or information, or whether you are employed in a city building or employed as a city worker, you have to have your mask on during work time. And then we've encouraged the restaurants that are open, both all the workers as well as customers wear masks. We have our health department staff is out and about surveying and looking at the businesses in the city, and we're doing everything with a small staff that we have. We're doing the best we can to keep that word out there that
Now, let me ask you
you
about
need this mask.
enforcement, because enforcement seems to be an issue. Of course, there's really no law that says you have to wear a mask, but these are mandates and rules that are made in different communities. Well, what do you advise people to do? You're in a store, you see somebody without a mask on. Do you approach them? Do you call 911, or do you just, turn the other way and walk away from them?
Yeah, I don't think that it's a 911 issue. And this is my opinion. I think that I've been in all of the above situations. I have offered people a mask. I have a box on my front seat in my car, and I'll say, "Hey, would you like one?" And if they want one, fine. If they don't, that's fine too. They know what you're talking about when you show them a box of masks. But I think that we've had kind of a policy of just courteous, gentle information for people. We advise that you put on a mask. Where's your mask? Rather than attacking people. I think the people in town pretty much have cooperated with that courteous way of being told and telling others about putting on a mask. I don't think that people should get arrested or get fined, but what we know is that if you're wearing that mask, you have a good chance of protecting yourself and protecting others.
Well, as a doctor, and you've been a doctor for how many years now, Dr. Browning?
Since 1982.
So
Wow.
quite a while now. Tell me, there's been so many studies, and people say, in the beginning they were told it wouldn't help, and now they were told it would. And of course, this virus has basically been a learning curve for most doctors because it's something new. And so as something new is tested, they find more reasons why you have to do certain things. As a doctor in the city of East Chicago and being the health commissioner, how do you think your expertise has come into play in regard to you being very proactive in advising the mayor?
Well, I've got a lot of years of experience and practice. I have a large number of people who rely on me to give them accurate and up-to-date information. I've been very open and honest. Early on, I said, hey, this thing is new. This is a novel virus, and we have to kind of get a baseline of information. Here's what, the guidance is on what we need to do. And then we have reacted and changed our guidance as new information has come about. So I think that, certainly in my practice, my patients rely on me to be as current as possible. And then when things become more current and things change, they expect me to offer them the change direction that comes with new information. And we've handled this coronavirus the same way. I just was doing some emailing and texting to my key partners in the city last night saying, look, the guidance has changed in terms of how to properly re-enter a person into the workforce. So we're going to look at and change our policy based on the new guidance. We've had a number of employees that keep testing positive and had not been able to return to work because of that. And what we know now is that there are some perhaps viral particles that allow the test to remain positive, but these individuals have had no symptoms, no fever for longer than the 14-day quarantine time. And so we know that probably most of those individuals can return to work and to their daily environments without worry. All that being on our baseline caveat that we've had in place a policy of still wearing masks, hand hygiene, respiratory hygiene. So there's still that base layer of protection there. So, but it's plain and simple. When you know better, you do better. So we've got a way of looking at some individuals, and it's just few that are like that, but a way to then now get them back to work and productive in the
How does
society.
information get out to people? I appreciate, of course, the City of East Chicago show here on WJOB, the Government Access Channel. How are you keeping your senior citizens aware of what's going on in the City of East Chicago in this regard?
Well, we have a number of ways that we get information out, either through print, print newsprint, but I think a lot of people get information nowadays from our East Chicago Health Department website. They get information from the City of East Chicago website, as well as many people are followers on Facebook, as well as religious watchers of East Chicago TV. So we've been able to use all of those media, even at times when we have urgent information that we need to get out. The city will put additional information in the water bill as they mail those out to all the citizens. And most people get a water bill. So there's a whole host of ways that we communicate. And we've been using everything, as well as word of mouth, public speaking appearances at some small venues. I've been out and about. I've had the opportunity to work at some of the testing sites on a Saturday and talk to people as they come and go and spread the word, whatever information, answer questions. So, all of the above, and we'll continue to do that. East Chicago's, in addition, has newsletters. Everything that's possible, we've taken advantage of to keep the word coming about what's new with this coronavirus. I've been saying for a long time, and unfortunately, I think my feelings are coming true, that we're going to be probably next year this time still looking at this virus until we get a proper vaccine that people buy into and receive. As well, I'm still also hopeful that somewhere there could actually be a treatment that, nobody wants to wait till they get sick to have to hope that some medication will get them better. But it sure would make us all feel a lot better if we had, a new drug that could, corner this virus for our people that do get sick. And
Exactly.
so
Dr. Browning, I know we're getting close to our time coming to an end, and I want you to be able to get out, anything else you feel is important. But also, I believe the director of multimedia, I don't know, Steve Segura, are you on this Zoom?
Oh, yeah. I'm here.
And you might have some things announcements you'd like to make for the residents of East Chicago as well. So why don't we, Dr. Browning, go ahead and go over to Steve real quick, and then we'll come back and bring you for closing remarks.
Okay.
All right, thank you guys. Yeah, Doc is right. We've increased the amount of newsletters that we have going out to the residents. We've added, I want to say, an extra issue a month now, just to inform residents who don't have the internet access, to be better informed about what's going on, especially with all this corona stuff going around. But there'll be more issues coming out, so just stay tuned. If you do not get an issue, call our office at 391-8206. We'll make sure we drop some off at your location. So right now we have an issue with our buses, effective this Monday, July 27th. Crosstown and Food for Less routes will run from 5 a.m. to 8:11 p.m. You have to obtain a revised schedule on our website. That's eastchicago.com. And you can even call the bus transit number at 391-8465. If you would want a copy of the schedule, we have it posted on our Facebook page as well. They're just down 2 drivers right now, so they have to modify the schedule to try to accommodate as best they can. We also have a curbside market over at the greenhouse. So if you want some fresh organic produce for free right now, every Thursday starting, we began this in June. All you have to do is go between 1 p.m. and 3 p.m. every Thursday in front of the greenhouse. There's a table set up there. You just pull your car up and they just hand you bags of fresh produce. So
And now, is this only available for East Chicago residents? Do they have to show ID or?
I believe so.
Yes.
But I'm sure if you want to call the park department, they don't want the produce to go in the trash, I'm sure. So if they have anything left, I'm sure they're going to give it out. But just in case, I would call them at 391-8474 and just get some more clarity on that. Yeah, there's not a whole lot of special events happening right now. We are contemplating doing one event. I'm not going to announce it yet. We're meeting about it today, and hopefully we'll have something kind of cool coming up in the very near future. If you get to the greenhouse, they're painting a mural there right now by local artist Felix Maldonado. Yes. He is painting all the way around the park greenhouse and the park department building. It's coming out beautiful, and just go there, take some pictures, spread the love.
He's an amazing artist. He's the one that did the Jackson 5 in downtown Gary. So this is a beautiful mural taking shape.
Yeah, and also we have some new sculptures in the park, so be on the lookout for them. We've got some other things we're planning for the parks, and it's a challenge because we're trying to figure out what can we do to get people to participate in something where they can just go on their own, and it doesn't have to be so we're looking at doing an I Spy thing.
Really?
So that's something coming up in the near future. We're meeting about it today as well. So yeah, we're trying to plan some stuff.
Well, great. I appreciate you weighing in, sharing the things that are happening. Now, parks are open. People are allowed to socially distance and walk through the park and enjoy the art.
Correct.
How about the basketball courts and things like that?
I think the parks are just fully open. They just want you to maintain social distancing. I know the greenhouse will only allow like 5 people in at a time. So there are some rules still at the parks. Same thing with shelters. I believe you can't have no more than 50 people or whatever the state mandate was. They're following those rules and trying to enforce them as best they can. It's a little hard.
Great. Well, thank you, Steve. I appreciate that. That's Steve Segura, the Director of Multimedia for the City of East Chicago. We'll go right back to Dr. Browning for any closing remarks. Dr. Browning, anything that you feel that the citizens of East Chicago need to know?
Yes. As we look at getting started back in school, we want to encourage all of our parents who have either, kids who are about to start school or even those who've already matriculated, that the East Chicago Health Department does have an immunization department. It's very important that they come and get their children immunized. We are ready and available to properly immunize any school-aged children in the city of East Chicago. The data does show us that during this pandemic, a lot of children have fallen behind because they've not been able to get into a physician's office. And so the health department, you've got, a wonderful asset there. We've got great staff, nurses that are there and ready to bring kids up to date. So whether you're going to be e-learning or whether you're in school physically, you still have to have a certain number of vaccines on your register in order to attend. So I encourage every parent, don't forget this, while they're making the decision, get over to the health department and get immunized. It's crucial. As well for adults, remember that flu season is coming in September, and it's important to get a flu shot. We do not need flu symptoms confused with COVID symptoms, or worse, you get the flu and are more susceptible to COVID. So we're really pushing flu shots this year for children and adults, for that matter, and for adults 65 and older, pneumonia vaccines. Very, very important.
So getting these vaccines, are they more likely to help a person, you know, when they may be exposed to COVID as far as their immune system?
Well, every vaccine has a purpose, and you know, we're trying to prevent pneumococcal pneumonia with adults who are 65 and older, as well as adults who have chronic diseases like diabetes and chronic obstructive lung disease, etc. You know, it's just generalized protection. But again, we've got this novel coronavirus out here. The last thing you need is to come down with a pneumococcal pneumonia, which makes you now in a compromised state, and you're even more vulnerable to this coronavirus. It's the people who have underlying illness that they have to fight the most, more frequently with this virus, and unfortunately have not survived that fight. So we've got to get our baseline of healthcare, bring it up to par. If you're behind on adult shots, go get caught up. And same thing for the children. We can't overemphasize how important it is for our kids here in East Chicago and surrounding areas to come and get immunized. We've traditionally been at the low end of the register for the whole state, and it's unacceptable when we have an immunization clinic right in the middle of the city at the health department where we can vaccinate.
Thank you, Dr. Browning. Steve, was there something you wanted to say? I'm sorry.
Yes, don't forget, we are behind in our census numbers. I need everyone to go to 2020census.gov and just fill out the census. Your data is protected, so if you're not a resident or not even legal, they cannot share that information with anybody else. But it's important to get our numbers back up. So they're moving up the start date to August 11th. And they're going to be doing person-to-person visits at all the homes now because our numbers are low, and we need you to go to the census and to just get counted, because those dollars are important for us. You don't realize how important this stuff is.
Right, and if you don't want anyone coming to your home during this COVID crisis, you definitely need to get online.
Yes.
You know, gentlemen, I want to thank you both. Of course, Steve Segura, Director of Multimedia for the City of East Chicago, Dr. Gerri Browning, the Health Commissioner for the City of East Chicago, and of course, Mayor Copeland for continuing to provide the City of East Chicago show here on WJOB for the residents. Thank you, gentlemen. Our time has come to an end. See you next month here in the City of East Chicago show. Coming up next, it's Veterans View, the award-winning veterans show here on WJOB AM 1230 and 104.7 FM. Thank you, gentlemen.